Well, I've made Matthew Holt squeeze himself into his tuxedo. Could we be dressed up to ring in the new year? Could we be dressed up to talk about the last of the 2021 deals that we forgot to get to at the end of last year? Or maybe we're dressed up to say goodbye to the name of this show and usher in the brand new name. Stick around and find out. It's the January 7th episode of the show that will no longer be called Health in 2.00. So, you didn't get sent champagne from 120 over 80, huh? Tough to be you.
Tough to be me. Plus, I had to get in this. Do I have to wear this tuxedo for every one of the new shows?
Every single one. Interview tuxedo.
We're up classing.
It adds a level of class to this that we didn't have before, right? I feel like the deals are going to be great that we're going to talk about. Like, oh my God, imagine when somebody goes public. Like, look how stiff you look.
All I can say is I'm holding my breath. Not because I'm so excited about the deal, because that's the only way I can stay in this thing. I've worn it for about 5 years. All right. Okay. So tell the people, Jessica, we're wrapping up. So it's New Year's Eve, except it's New Year's Eve for January the 7th.
And so what are we doing?
we're wrapping up last year.
We're wrapping up last year. And this is going to be our last version of the show named Health in 2.00 because we're new year, new you, Matthew Holt. We're shedding our Health in 2.00 past and moving on to bigger and better things.
If we wait to the end, are we going to hint what the new one's going to be?
I think we should, don't you?
And how different is it going to be?
Not very, other than the name.
I came up with all these differences in formats.
I don't know if you've noticed, but I'm kind of a one-woman hype machine.
All right. Okay.
Also, I really do think that you should be wearing a tuxedo from this point on.
I'm not sure how.
Are you ready to get through these deals, my friend? There's so many of them.
Okay, we have the
end of 2021 depends on you.
Ready, steady, and go.
Embold Health gets $20 million, brings their total up to $50 million. Matthew Holt.
Okay, something to do with like appropriate, effective overall cost of care, figuring out the individual clinician level, some kind of searchable ratings about, and then benefits tool for members. Apparently they sold this to Walmart and the CEO was ex-Walmart. Echo Health Ventures, the blues of North Carolina Regents and a bunch of other blues. Jessica Zieski and all her friends are in this. Sounds interesting? No idea.
Watch the interview on my show. Brainomix gets 21 million in a B.
Okay, this is a UK-based AI stroke detection thing, which is now going beyond that into other therapeutic indications, including lung cancer, cystic fibrosis, and much of other stuff. I'm not quite sure. Boehringer Ingelheim Venture Fund Pharma is in this, as is Tencent, the Chinese.
Town Hall and Health 24/7 and some others are in Zing Health for 25 million. What does this one do?
Yeah, this is really weird. This is a Medicare Advantage plan, minority owned, African American owned, run plan based on social determinants of health in 3 counties only in Chicago. Why you could boy with a plan at that level, I don't know.
Okay, Quartet acquires Innova Tel. Tell me about this.
Well, last time we had Quartet on, there is this money. I said they're just distributing to other people's networks, figuring out which mental health care you need. Now they've completely gone against that and they bought their own network. Innova Tel had 130 clinicians on staff. I assume they're doing this to sort of provide a medical group as well for people who don't have their own network.
Prolucent Health gets 11 million.
This is yet another different jobs marketplace. If you haven't noticed, there's a labor shortage. If you haven't noticed, everyone's becoming a travel nurse. And if you haven't noticed, you can raise money very easily for anything that looks like it might be an employment agency.
Mightier gets 17 million, brings their total up to 29 million.
You said I was never going to get there.
And you said keep the questions short, and so I did. Although I would like people to know, for the record, that I am rarely the problem on this show.
Apparently, I'm the problem on the show all the time.
What okay, like let's go back minute by minute and see who talks more in that 2 minutes. Not me.
Mightier. So this is the video game. It's got its own little what are those things called? Tablet. You get it. It's for kids. It's got a wristband that tracks the heart rate variability of the kid. They play the video game. It's somewhat similar to a Keeley in that it's for ADHD. You're supposed to play the video game. It's supposed to be able to only work if you can figure out how to control your heart rate variability, which is the reason, kids having tantrums and getting wound up or whatever. So it's supposed to work for this. They raised about 12 million last year. They just raised this other 17 million. Came out of Boston Children's Hospital. All kinds of people are in this. Sony's in it, Digitex Ventures. The What If group that I sometimes invest in into mental health. They're all in it. I tried this with my kids. Probably one who does actually has ADHD last year.
Yeah, how'd it go?
The only video game I've ever seen her not play. She just got bored and didn't use it. So I hope it works better for other people's children. She was just like, couldn't be bothered to put the wristband on. I said, fine, you can play a video game. I'm not going to stop you. Wear this wristband. I think she took it off for about 20 minutes.
How much of that do you think was the fact that the game was boring versus how much of the fact do you think that she said no because it was something you wanted her to do? I feel like there should be a chart.
But their parents are going to have to buy it for them, right? It's a
yeah, but you're going to have to create you can't play this. No, don't wear the wristband. I'm not giving you this piece of technology. Are you out of your mind? I mean, look at kids and phones. It's like you say no, and they're like, phone.
Oh, so what you're saying is that, as usual, my
reverse psychology for the psychological help.
I don't know what I'm doing. Yeah, I'm happy to deliver the child to you or anybody else who will take it to figure the whole thing out.
Bring that here.
Okay. All right. So I have to keep dealing with her? Oh, well. Well, Mightier wasn't the answer. She went through Brightline. I haven't tried a Keeley with her yet, but you have to have that prescribed, whereas Mightier is, you can buy a DTC or whatever. And a Keeley's raised a lot more money, but who knows? We'll see.
I love that you're guinea pigging your own children in this digital health stuff. I love
Hey, you see my piece on TCB? I'm guinea pigging myself. Can I figure out how to pay one medical? The $7.95 they asked me for the $900 visit I had. No, but a comment about that on TCB if you read that. We're gonna have more fun stuff on TCB coming up. But the most fun is, are we changing the name of the show? Did I hear that earlier?
Yes, it's the reason I got you into a tuxedo. Although
the very last Health and 2.0.
People chime in to us because I want to know. You want him to keep that tuxedo on? Let's see how long we can go with that tuxedo on this guy.
I will have to drop about 20 pounds.
Like it ups the ante. I feel like people have raised so much money in this space. You should always be wearing a tuxedo.
You should have a top hat, like a Monopoly man. Yeah.
You are kind of like the Monopoly man. Maybe you have a monocle.
I can have a monocle. Hang on.
I need somebody want to sponsor that. Sponsor the monocle.
Give me a monocle.
All right. So should we tell the name so we can get out of this?
All right. The new name is.
After 247 episodes of this show, living in complete obscurity, we have decided to become SEO optimized and have now changed the name to, drumroll please, Mr. Holt. Health Tech Deals.
Woo! Health Tech Deals it is. By the way, the show was originally supposed to be like Q&A about health technology. It became Health Tech Deals within about the first 10 shows. We should have changed the name before. And apparently it's people who are hanging on to the past, like doing last year's news this year and living in the past like 5 years ago when they were doing Health 2.0. The whole point was, the joke was, instead of Health 2.0, it was doing Health in 2.00 minutes. Yep. Did anyone ever got that? Probably not.
I think when we had the first initial 30 people, I think, watching this, I feel like they got it. And then I think we lost everybody because, no, truly, I think we got like a whole bunch of different people who started to watch us. And then this year, when there was so much money pouring into this space, people are like, who the heck? Why What? Okay, well, hopefully we can be less mysterious. We'll be doing Health Tech Deals. And We're gonna end up on Kramer on CNBC Watch. Name change was the beginning of the whole thing. Kramer's gonna be like, get me that girl with the laugh and the guy in the tuxedo. Let's go. Health tech correspondence.
We will have to get a lot more sponsorship if I have to wear a damn tuxedo.
A girl can dream. A girl can dream. Yeah.
Either I need a new tuxedo or I have to go with, was it Found last week? Their weight loss program and lose my 20 pounds.
Yeah. I mean, you can sponsor anything. Sponsor Matthew's weight loss, campaign for 22. You can sponsor his monocle, new tuxedo fund. Still looking for somebody to take that timer, Rooster.
What happened to Tiger or Julie Yu? I don't know.
Well, I offered, right? Julie Yu, what were we? You were going to name it after her.
maybe Andreessen just couldn't afford it. They spent all their money.
Come on, Andreessen. We know what you're doing over there. We know what you're watching.
All right, you better get out of here now. We've finished the name change. The excitement's over.
Do comments on how much Matthew Holt looks like the new James Bond in his tuxedo. Head on over to Twitter. He's at
There is no new James Bond.
You are it. That's why.
I am the new James Bond. Oh, man. I'm a little bit old to be James Bond. Maybe.
Said it, not me. I'm over there at Justamasa. Feel free to send me Vroom anytime.
Me too.
No. And to never miss an episode of the show that will now be called Health Tech Deals, please head on over to thehealthcareblog.com and subscribe for our email newsletter. You'll get these shows as well as my WTF Health interviews and all of the other great content that appears on the blog, including those great articles about chasing down $7 bills with One Medical, delivered directly into your inbox. You can't miss that on the weekends.
Well, Jessica, it's been...
I'm so excited. We're going to do Health Tech Deals next time. How fun.
Can we spare a minute for Health in 2.0? The fact that we've kept this going for on the way to 40.
This is the 247th episode, and we're stupid for not changing it at 250, but whatever. Should have looked at that. 247 though. Shoot.
That's a lot.
All the deals.
And they will continue to keep going.
Yeah. Next time we're covering 2022 deals. So, hey, whatever.
We're getting up to date. Look at us. We're like almost presentists.
We're done now, yeah?
Yeah, we're done.
All right. We'll see you guys. New name, new deals for this new year. Bye.